My name is Scott Sanford. I'm the co-founder and chief growth officer of HealthiestYou. I'll be your host today and your presenter. We have a very exciting announcement for everybody that's joined the webinar. We'll be giving you a little demonstration of our new smartphone app that's getting ready to come to market here in just about 2 weeks from today. For those of you that are new to HealthiestYou, and this is the first presentation you've attended, so thank you very much. We appreciate you for joining. We host this call once a month, the first Thursday of every month. It's our national webinar where we invite all of our distribution partners from across the country on this call to hear the latest and greatest and everything that's happening here at HealthiestYou. So we want to always say a special thank you to our partners that have helped us reach incremental growth, record-setting growth in the telehealth industry space and in the healthcare space. So we appreciate everything you do on a daily basis to share HealthiestYou with your client base and make that an integral part of that benefit plan design out there. So for the agenda today, for the new folks that are just dialing in, and maybe this is the first time you've heard about HealthiestYou, we'll give you just a little product overview of what we do. Then I'll go into an app demo that's getting ready to come out here just in a couple weeks. This is a smartphone app for the Apple platform and the Google Droid platform. Very excited about this to continue to push that engagement and utilization up in the telehealth industry, because we know every time somebody uses HealthiestYou, instead of accessing that very costly and time-consuming health plan, everybody saves time, they save money and resources, and it creates a win-win situation for everybody involved. So let's go ahead and get started here. We'll get into the PowerPoint presentation. So kind of the foundation of what we do at HealthiestYou is we're in a paradigm shift right now. So we're known in the industry as kind of a telehealth and a wellness content provider. Well, we're shifting to even more than that, where we're actually becoming your health ecosystem. In fact, when we get into our we get into our app, which we like to call Mom, because that's where you go for all of your healthcare needs. Typically, your mom's kind of helping you get better. She's helping you set doctor appointments. She's managing the benefits within the household. Typically, our app is growing into becoming more than just a telehealth access point, but a place where you can go to manage and understand your benefits and maximize your efficiency in healthcare. The foundation of what we do is certainly connecting patients to a nationwide physician network over the phone, because we know over 70% of the reasons we go see a doctor, we can safely handle those issues right over the telephone, avoiding unnecessary emergency room, urgent care, and doctor visits, driving down costs and creating a substantial ROI. If you look at the top 9 reasons that we visit the emergency room for non-emergent issues, it's these top 9 issues right here. Now, this also happens to be almost identical to HealthiestYou's top 9 diagnoses over the phone in 48 different states. So we look closer at our physician network. They are all licensed and they reside here in the U.S. So they're all board-certified physicians. They can diagnose, they can treat, and they can prescribe medication right over the phone. That's what they're trained to do. We have the largest telehealth network in the country. We also have the highest utilization in the telehealth space by about 20 times. Our service is available in 48 states. So Idaho and Arkansas are the only states today that have a temporary hold on telehealth. We're providing service in 48 other states. Here's how it works as far as the member experience. It's very simple. There's 3 ways you can access HealthiestYou. You can simply dial an 800 number, get connected with our care line representative, and get yourself on a path to be connected with a physician. You can schedule an appointment online, or you can now, here in a couple weeks, you'll be able to download the smartphone app and connect that way. So the first thing we're going to do on the telehealth component is we're going to make sure we have your medical history. So we'll, over the phone, we'll get your medical information, the same thing you fill out when you go to that doctor's office and they hand you that clipboard. We're going to make sure we have that information so we can provide that to the physician that's going to do that consultation. We route the call to the appropriate doctor depending on the state you're in. The doctor reviews the patient history, then is connected to the member. If a prescription is suggested by that doctor, that's sent via e-script to the member's choice of pharmacy. Next, the doctor updates the EMR with your consultation notes. So those notes can be shared with your primary care physician, because we're going to ask you who your primary care physician is. And we're going to, we'd like to keep that loop of care going there and share those notes back with your primary care doctor. Then we're going to share some Dr. Kelly Trader follow-up health content based on your particular diagnosis or your needs. So the survey feedback from the patients or our members: 97% customer satisfaction rating, 94% of the patient medical issues resolved over the phone, 97% of the members would recommend HealthiestYou to a friend. Average consultation duration is 13 minutes, so faster than you can even get in your car and start driving to a facility typically. You can be on the phone and done with a full, thorough consultation, have a diagnosis, and potentially have medication sent over to a pharmacy to be picked up. 95% client retention that first year. So we put that up there because people keep HealthiestYou. They like it. Even if that BOR changes with that group, they still tend to keep HealthiestYou, even if the broker may change out or the insurance carrier may change out. We have a $0 consultation fee typically. So our standard model is a no consultation fee model. You get full access to HealthiestYou, and there's no extra cost associated with a consultation with a physician. So what we do at HealthiestYou is we're an engagement company, right? So we get people to use our services, drive down utilization within the health plan, create an ROI. We like to use the analogy of Uber, for those of you that have used the Uber app to schedule transportation. It's really changed the transportation industry in a very few short years. Similar to what we do. So we're going to guide you to the appropriate care, whether that be a telehealth doctor, whether that be searching network providers within your particular health plan coverage, whether that be sending healthy content to you to just keep you well and keep you out of that doctor office, and a number of other different services that we can provide. So how do we get that 40% utilization that's 20 times higher than our closest competitor? We created this engagement pulse slide to kind of illustrate that. So when you sell a group or a group comes on board here at HealthiestYou, we have a team that all they do is they reach out to that group and they create a 365-day customized communication plan. Okay, and there's very extensive thought and processes involved with that. What we found over the years is that companies communicate differently with their employees. Not everybody's the same. We have an airline that's a client. Much different communication process than, say a company that has one large campus with 1,000 employees on it that may be very digital or whatnot, and they've got a captive audience with the employees there at work every day. So we create a customized plan based on that particular company's communication process. We send out a very nice fulfillment kit. So outside of open enrollment, the first touch point to the employees may be this member kit. It's the same company that does the American Express Black Card. Very high quality credit card style membership kit. It's going to show you how to download the app, explain the components of the offering to you. On the marketing side, we're going to send that admin a launch kit, which has some nice HealthiestYou swag in it, the basics, break room posters, magnets, all kinds of fun stuff in there for the office space, but it's also going to show them who their contact is, how to use the HealthiestYou group management system that's all digital if they're not on an EDI feed. Very turnkey, very easy to launch HealthiestYou within the company. We have co-branded enrollment sites, so the companies can have their own website branded to them that they can direct their employees to go to, and they can learn all about HealthiestYou. They can get synced to the member portal and get everything set up there so they're ready to go when they need that first consultation. And then we do the basic monthly email communications and whatnot, very short messaging, tongue-in-cheek, just keeping HealthiestYou on the top of their mind so they know to come back and access that. Now, we also have a utilization reporting and monitoring team, so we do send frequent utilization reports so that company knows where they stand. If you're a small group, so maybe 25 employees and under, we do that annually for HIPAA reasons. If you're a larger group, in the thousands of lives, we can do that monthly or quarterly depending on your needs. Typically, it's done quarterly. So you see where you stand with utilization, how we're redirecting claims within that group, and really communicate that ROI and the usage around HealthiestYou. Now, what happens when you get great usage in the plan? That 40% number as just an example. I like this client case study example here that had our competitor for 2 years prior to HealthiestYou coming on, and they just didn't see any change in their claims because they really didn't get any utilization. And that consultant, of course, caught one of our webinars, like you all have joined here, and hear us touting about 40% utilization plus, and said, you know what, I'm going to switch HealthiestYou next renewal. And this is what happened that first year with HealthiestYou. Claims went down 39%, a 37% reduction in cost around claims, 2.2 fewer paid time off days per employee, representing a $30,000 savings in just redirection of claims. So they got over 100% return on their investment for the spend for that particular group. Here's another one. This is a larger group, 2,200 lives. This is a self-funded group. They have 70 different locations, and they have 30 different HR directors. We trained all the HR directors and made sure all 70 locations had content and information to communicate HealthiestYou to. First year, they hit just a little bit higher than our average utilization, 44%, did 1,071 telehealth consultations, reduced the urgent care spend alone their first year by 37%. So the health insurance provider that gave this data back was absolutely shocked by the change in utilization within that plan, thanks to HealthiestYou. So of course they went back and they changed their plan a little bit. They said, you know what, we don't need a primary care copay of $25 if we're doing 1,071 telehealth consults per year. So let's save a little bit more money for the company, and let's bump these copays up here and change the plan, because that's exactly what HealthiestYou does, is it forces the way that benefit plan is designed. Now let's take a look at our new kind of technology baby here getting ready to roll out, which is our app. First, I'm going to show you kind of the member portal experience here. Let's bring this up so you see the foundation of how this works. This is going to change quite a bit from the previous member portal that we have. So when you first log in, you'll see the basic information and how to access the program. You want to call a doctor. It's pretty simple. Just hit this button here and you can be connected right to a physician. First thing you want to do, and the same thing you do when you download the app, is you want to sync your health plan. So you can actually put in your health insurance carrier, your group ID or individual ID from your membership card, and it will sync right to your plan. So the first time I did this, it showed us exactly where I stood with my deductible. How nice is that? I can look up providers within my plan. So I'm going to sync my phone to the screen here, and I'll show you how this works on the app. Give me just a second here. All right. Should see my smartphone show up here on the screen. There it is. So the first thing we built in here on the smartphone app is something called geofencing. So we put a virtual fence around all medical facilities that you may visit. So urgent care centers, emergency rooms, doctor offices. This is something commonly used in retail. So you'll see it in like the Starbucks app or Retail Me Not. So it knows where you're at. If you walk into a Starbucks, it can send you a coupon or send you a notification of the special of the day or the new music they're promoting, whatever that may be. So we brought that philosophy over to healthcare. This is the first time we've really even seen anybody do anything like this in our space. But when you walk into an urgent care center, we're going to remind you, we're in an emergency room. So we get busy, we forget we have HealthiestYou, and maybe it's a Sunday night at 11 o'clock at night, and your daughter comes into your room there, and she's got an earache or pink eye is showing up, and you know, you jump out of bed and you get dressed and you run over to the emergency room. Well, we're going to ping you, we're going to remind you, because when you step into that virtual fence, it's going to pop up on your phone here. Benefit reminder, don't forget you have HealthiestYou, okay? And you can connect with a physician for free. So as you're walking into that emergency room and you see that big line of people, and you know it's going to cost you on average about $1,100, right, to do that visit, it's going to say, you know what, maybe you should just call and connect with a doctor now. So you can click Connect Now. It's going to have your the patient information, your location, the callback number. Do you want to share those notes with your primary care physician afterwards to keep that continuity of care going? And just click Connect Now. So we're going to dial you right into our Careline representative team. They're going to make sure they have your medical history, and they're going to connect you with a doctor on average of 9 minutes and you'll be on your way getting a diagnosis. You can avoid that entire emergency room visit. After the consultation, we're going to show right on your screen here, what would you have done if you couldn't have consulted with that friendly telehealth doctor? Well, I was going to go to the emergency room. So what are we going to do with that answer? We're going to also ask you that over the phone. We're going to compile that into the utilization report. So when you go back to meet with your groups, we're going to say, look, we had 500 people this quarter that said they were going to the emergency rooms, but had HealthiestYou in there, so they didn't. At an average emergency room cost your company being X, which is typically $1,100 plus, there's massive savings around that. So we can demonstrate right to the group the savings they're experiencing, the claim redirection, the productivity increase. So we got extensive reporting going into Q with the new rollout of the app and member portal. Wellness reminder. So in this example, you called in. We know you got diagnosed with allergies by the ICD-9 code, so we're going to push a little video to you to your phone. So maybe you want to watch this quick. Dr. Kelly's going to come on and just give you a little 2-minute tutorial, some things you can do to mitigate symptoms or maybe avoid that doctor visit next time when these allergies come up, on just some tips you can do. So we're going to push health content to you at the time of need based on your particular instance. Same thing, geofencing applies to our pharmacy benefit. I know we get rave reviews on our pharmacy pricing engine. Well, if you walk into a pharmacy, we're going to encourage you to maybe check the prices around you with our pharmacy pricing engine. So it's pretty simple. Put in any medication here that you want to shop. Whoops, hit the wrong button here. So check prices around me. Put in any medication. We'll do Lipitor. Put your dosage in. Click Get Low Prices, and it's going to shop all the locations by you and tell you that exact cash price for that medication. So we get lots of positive testimonials on this. Lots of folks saving a ton of money on medications, and that you just can kind of clip it to your screen here. Looks like my phone came off the screen. Let's bring it back up. So clip this coupon right on your screen. You show that right to the pharmacist, and that's the exact cash price you pay for the medication there. When you're done, it's going to price it against your health plan. So if you've got, a copay for pharmacy medications, our pricing engine will beat that copay about 7 out of 10 times. So you can make the decision: is the health plan giving you a better deal, or is HealthiestYou giving you a better deal? And then go from there and decide which one you want to use. Okay, let's jump back here. All right, so if you want to access the app, just click Start here. We're going to use something called native language technology. So you're just going to complete a series of sentences. So who needs help? And we'll load from the census data who has access to HealthiestYou. So it could be yourself, maybe a spouse or a dependent. We'll say myself. What do you need to do? Well, do you want to do a telehealth visit? Sure. Let's get you in queue. So that's the same queue we saw through the geofencing side. We'll connect you right away with a CareLine representative, and we'll get you off and running on that telehealth consultation. But let's say you want to schedule a doctor visit. So when you download the app, just like I showed you on the member portal, you simply put in your health insurance provider. You'll put in the group ID number from your health insurance card or individual ID number, and it's going to sync the doctor network right to this app. Same thing applies for dental or vision. So let's say you've got dental coverage and you want to schedule a dental visit. You just want to do a cleaning. It's going to show you in-network dentists based on your particular benefits, and you can call that dentist, schedule an appointment. Sometimes they'll even expose their schedule here, and you can set it right from the smartphone. Now this is in-network based on your particular benefits that you have access to. So we're syncing to the health plan payer networks. Have over 140 some different payers loaded in here. Based on your particular coverage, it's going to expose the in-network doctors specific to your plan. Pricing procedure transparency. So this is something that we hear from folks all the time. We all may have been there where your doctor says, look, you need to have this procedure done. Maybe it's an image test or a CT scan as an example, but you don't know how much it's going to cost until you just go do that, and then you get the bills in the mail later. Well, this can help you just know what you're in for. So if you got to do a CT scan of the chest, it's going to search providers and show you in high-low range of what you can expect to pay out of pocket based on your particular benefits. So you kind of know what you're getting into there for that procedure. And of course, you can call providers and maybe shop it around a little bit, let them know your health insurance coverage, and see if maybe you can't save a little bit of money by just going to a different provider. It's just exposing the transparency of pricing to folks so they can make different decisions accordingly. Okay, I think we kind of covered everything on the components here. Now we are also adding here at launch, you're going to have customized diet recommendations. So maybe there's folks that are vegan or paleo or gluten-free, and you can put that in here, and it's going to sync all these awesome recipes and diet recommendations based on what you're looking to accomplish. We are also syncing in here, probably won't be live on the first rendition, but we are putting your Fitbit devices and Jawbones. We have 55 different devices that will sync right to this. You can see all in one dashboard. If you're working to be more active and get more motion going in your life to burn more calories, that will sync right here to the dashboard. So we're pretty excited about that. So just some functionality here on the family side. You can, of course, add photos of your family. You can build out your family tree here. If you have family coverage with HealthiestYou, they'll be in there. You'll see the history, so the consultations you've done, date and time of those consultations, notes associated with it, and so on. That's all synced here to the app. You'll have an opportunity to take a photo of the front and back of your insurance card, which we certainly encourage, because sometimes you may need care but may not have your insurance card with you, but you most likely have your phone with you. So take a photo of that, keep it on your phone, and you have access to it. Okay, so key takeaways on the app. Geofencing, we're going to remind you there might be a cheaper, more efficient, effective way to resolve that healthcare issue. Walk into an emergency room, we're going to send you a little benefit reminder. Encourage you to connect with a doctor now if you'd like to, or you can X out of that and just continue on with your emergency room appointment. We can sync with your health plan. Put in your health plan carrier, your group ID, and it's going to sync all your pertinent information to your particular health coverage based on that information, like I did here with mine. So I know right where my deductible stands with my particular coverage. So lots of exciting functionality in that. We like to call our app Mom, because at the end of the day, Mom typically knows best, and our app's here for you. So access this, use it, use that member portal, and there's all kinds of great functionality around that. I'm going to skip through some of these slides here because we covered these already, and let's get into benefit plan design. So this is a discussion point we like to have frequently here at HealthiestYou with our distribution partners is, where does HealthiestYou fit into that benefit plan design? And I think this the app has just made it more clear that HealthiestYou fits in the front end of that benefit plan design. So our most successful producers, the app's going to even just push this further, is they say, you know what, if I'm talking to an employer group, I say we got to start with HealthiestYou, because that's where you can resolve 70% of your healthcare needs. So we've got our physician network waiting by. You can sync your health plan there. You can shop for medications. We're going to help you find great prices on that. So if you can resolve 70% of your healthcare needs with HealthiestYou, let's start there. And then after that, let's build the appropriate major medical plan around it for the 30% of your healthcare needs, typically those bigger items, right, that can't be resolved over the phone or whatnot. And that's where your expertise comes in. And let's package that appropriate major medical coverage with it. Might be a PPO, might be an HSA, might be taking that group self-funded. That's where your expertise comes in. Then you can talk supplemental medical. Do we need to put any kind of a gap plan or a critical care? Then down to your ancillary, your dental, your vision, and then down to your financial. So what's happening is, it's happening for a while now, is HealthiestYou becomes the front end of that plan design. The app's going to push that further to make it very easy to manage and understand your benefits. And if you follow this presentation process and this build-out process, it's very, very effective. It differentiates you from your competitors, creates the best solution for your client base. Now, on our distribution side, we have a very large book of fully insured business, typically small group business, under 100 lives. HealthiestYou is an excellent fit for fully insured business. Self-funded, a no-brainer, right? You got a self-funded group. They're looking to drive down costs. They can see that cost change every month with the shift of claims coming to HealthiestYou. ACA plans, you may have caught our webinar, gosh, it's probably been a year ago now, titled How to Turn Bronze into Gold, right? We're going to show you how to take a low-cost plan, package Healthiest You with it. It feels more like a gold, but it only costs are similar to a bronze plan. And then if you're buying a platinum plan, well, you want the best of the best. Healthiest You is a great fit with that, right? It's gonna keep your time and expenses down with healthcare, as your time may be valuable. We're a great fit with MEC plan or limited med plans. We're partnered with payers. You may have heard we're in the All Savers self-funded group plan with United Healthcare. We're built into that. Everybody that has the All Savers program gets Healthiest You included at no extra cost. Lots of TPA partners out there having tremendous success with Healthiest You. Associations. We do a lot of individuals. So we have an individual plan. You don't have to be part of a group to buy Healthiest You. It doesn't have to be packaged with major medical. Online administrators. We're growing substantially in the online administrator space as well. So there's really a great fit for Healthiest You. I know many of you on the phone have lots of different opportunities out there. Let us know. There's a fit for Healthiest You in every one of those opportunities in one way, shape, or form. Okay, well, let's look at the pricing. For those of you that are new, our pricing here is we've got the employer paid pricing in this top column, the blue row. We've got voluntary and individual on the bottom, and we break it down by group size. So 2 to 99, $9 per month. 100 to 249 goes down to 8. We'll go all the way down to 6 here for 500 to just under 1,000. If you got a group 1,000 and up, give us a call. We're happy to put a custom quote together on that. We'll see if we can sharpen our pencil and get aggressive at that. If we can, we will. This pricing here has a 15% commission built in for all of our producers. You get 15% commission on these rates for as long as they're a member. They have unlimited consultations with no consultation fee. So they can call in, speak to a doctor as many times as they want to. They can use the app, download the app for free. They have all the functionality on that. What you see here, this is an all-you-can-eat buffet. So this price includes everything, no extra cost associated with it. Same thing on the individual side here, 11 for the individual, 15 for the family. This is non-group business, voluntary. They can buy this family for $15 a month. Same rules apply. They get unlimited access. They can shop medications. We've had people that have just saved enough just on our pharmacy pricing engine to offset the cost of the Healthiest You membership for the entire year. So lots of value there for the individuals and groups as well. 15% commission also applies on the individual voluntary side as well. Okay. So next, let's take a look here at our partner portal. So first thing we encourage you to do after this call is to go to HealthiestYou.com, which is right here. Click on this Partners tab, top right-hand corner, this green box, and you can create your own registration. So register here. You have access to all of our online tools. It looks like this when you log in. You can buy the membership for yourself at a 30% discount. So all of our partners have an opportunity to get Healthiest You at 30% off. It's a great deal. We know that the first thing we get asked every time we do a training is, how do I get this membership for myself? I want it. So we make it easy for you to do that. Just enroll right here. And we know, of course, if you use it once, you've got it. It's, of course, much easier to sell. And all of our top producers have the Healthiest You membership for themselves. And, of course, you can buy it for your entire agency if you'd like to as well. Okay, the first thing you're going to see here are the number of proposals you have out. So this partner portal is customized proposals. It's email marketing. It's an ROI analysis program in here. It'll show you the monthly volume of those deals that you have out in proposals, the 30-day snapshot, the weather where you're located at, your activity feed. We have all kinds of health insurance news that's plugged in here. So if you're looking for good content for your clients and your newsletters, come here. This changes every day, and you can Facebook these, Twitter, LinkedIn. You can email them, or you can go right to the article to learn more about them. Now let's say you want to do an email introduction. And while this next piece is loading up here, I just want to remind you, feel free to use the chat box or the questions box here on your GoToMeeting control panel. And any questions come up, go ahead and type those in, and we'll do our best to answer those. I'll start answering these here, some of these here in just a moment. So we want to make sure that all your questions are answered here from this call. So email marketing, simply put in an email address. You can invite brokers onto the platform. You can send communications to HR directors or company owners. Creates a nice HTML template. It's going to have your information here. So the person that's sending this out, your contact information. So it's a nice HTML, encourages them to learn about HealthiestYou, maybe watch a video here, and you can follow up and continue that appointment. We have an automated webinar system. Again, you can send invitations or you can watch webinars yourself. 2 different messages. One is targeted towards a broker. One is targeted towards an HR director. So they can join a little 15-minute webinar and learn exactly why HealthiestYou is such a critical component for their particular company. We have a calculator in here, which is really fun for those self-funded opportunities. It'll show you exactly where you need to be on a utilization basis as it pertains to that particular company's spend around healthcare. So this is fun. Come in here and play around with this. Put in the number of employees. So we'll do a 1,000 life group. No need to put the number of dependents because we're going to bill off of the primary members, the employees only. So let's just put this one at $6 here. Family is included for free. And let's say they're doing, 2,800 doctor visits a year, and they're doing, we'll call it, 1,300 urgent care visits and maybe 700 emergency rooms. So you can take that data right from their health plan, plug it in. What's their average cost per visit? So we'll do some kind of national averages here. 125 for primary care, 175 for urgent care, and ER is usually well over 1,000. But we'll put it at 1,000. And let's say you can just redirect 10% of those claims. Okay, and what's that look like? So let's crunch the numbers real quick. So if you've got 1,000 insured, 1,000 employees, I should say, doing 4,800 total doctor visits in a year, let's say we can just carve out 10% of those. So 480 out of the 4,800 visits, they're going to resolve their issue with HealthiestYou. They're going to call for free, get their issue resolved, and it's a claim that didn't hit the plan. So in this example, it's cost about $72,000 for the year for this group to have HealthiestYou. But if we can redirect 10% of the claims, the first year savings could be $127,000 for a 77% return on their investment, using some pretty conservative figures here. We'll show the 3-year savings by location, reduced absenteeism. So this data comes from the U.S. Bureau of Labor, the AMA, and the EPA, because we see absenteeism change a lot. I show you in that case study there, 2.2 fewer paid time off days. When you can call, you're at work and or you wake up in the morning, you got allergies that are killing you, call into that doctor, pick up the medication on your way to work, and you're continuing with your day, it's going to affect absenteeism. The environmental impact. So average trip to a doctor is 16 miles. Well, you don't have to do that commute anymore. So here's your fuel savings, the CO2 footprint savings. The prescription savings for the employee if they're using our pricing engine. Right? And you can go back and you can say, you know what, I think we can redirect more than 10%. Maybe we can hit 15%. Let's crunch the numbers on that. So you're spending $72,000 to save $191,000. It kind of becomes a no-brainer decision, right? For these self-insured groups, especially where you can demonstrate that ROI right for them. So at least this gives them an idea where if they hit certain utilization points or redirection points, they know how their spending is going for HealthiestYou. Let's say they are a very underperforming group at HealthiestYou, and they can knock that cost down from $6 a member to maybe $1 or $2. They're not quite at a break even yet, but what a tremendous value they're getting for that investment on HealthiestYou. Of course, you can do custom proposals in here. So if you've got a group that you want to send a proposal over to, you can print it off, take it with you. You've got the information here for the proposal. They can watch the video, the financial breakdown here. They can accept the proposal, request changes. It's all interactive. They can see some of the stats around the product here, learn more about HealthiestYou. It's all digital, turnkey, and easy. Again, you can print it off in PDF form if you prefer. take it with you. But any of these communications you send out on the system, it's going to remind you that, hey, you sent an email out or you sent an ROI document out, and once they open it, it's going to send you a notification that, hey, they opened it, time to follow up with them and make sure the questions are answered and close some business together. Now you can see your commissions in this system as well. So once you sell groups, you can see those groups, the commissions associated, when you're getting paid on those, if they paid on time and whatnot, and how that translates back to you. So let's get to some of the questions here that have come up. Okay. Here's a question specific to the All Savers plan. Does any of the engagement timeline change if the rollout is part of the UHC All Savers plan? That's a good question. So we've probably got quite a few folks here that have sold the United Healthcare All Savers self-funded program for groups under 100 lives that HealthiestYou is built in automatically. That doesn't change the timeline at all. It may be a little bit of a delay since we are getting the information from United Healthcare in that example. There may be just a little bit of a delay on when that kicks off. But no, all the process is the same. We reach out to those All Savers groups. We welcome them aboard to HealthiestYou, and we kick off that utilization and education drive and have a lot of fun with that. Let's see what other questions we have. Okay. How small of a group can you work with? So we can go down to 2 lives in a group, and we can even write individuals. So I guess you can say we can go down to 1 person, over the age of 18, of course. Does the broker get the same utilization, or does it only go to the group? Good question. We certainly are very broker and consultant friendly, so all the information that's going to the group also is going to the broker. That message is coordinated there. So if we've got a utilization report, and frankly, most of the requests for utilization reports come from the brokers and consultants. So many times it will go back to you all as a broker consultant, and then you can present to the group, and we can assist you with that if needed. Okay, let's see. Rolling through the questions here. Some people had lost their screen, got it back. Okay. Another question around utilization reports. I think I answered that in the last one. Somebody here asking for a question on how HealthiestYou might compare to a competitor. We'll be happy to certainly assist you with that, depending on that particular competitor. So, you know, we kind of get lumped in the telehealth space, but we're far more than just a telehealth provider, especially you can see with the new technology rolling out. And our new communication pieces, I think, illustrate that appropriately. So if you want to check the box, telehealth provider, a cheap provider with low utilization, virtually no ROI, if any ROI on that particular investment, there are options out there. But if you're looking for a product that engages the member and that employee and steers them down a path of the most efficient care and help them understand their benefits and drive up utilization on HealthiestYou and telehealth, we're certainly that provider for you. Okay, there's a question around how we can coordinate with insurance, and I think this question is probably around how you see some of the benefits of your health plan on the app. It's simply done by the group ID from your health insurance card and then the health payer. So if you have Aetna, you put Aetna in and the type of coverage on the drop-down box, put in your group ID, and then that syncs it. Okay, I'm going to keep searching here through these questions. Can this help people on Medicare who reach the donut hole with prescription coverage? Certainly would be a nice option for them to price the medications out and save a lot of money when they're into that donut hole situation. Absolutely, I think our pharmacy pricing engine could be a tremendous value for them. Is there a way to sign up as a broker independently to get the product? Absolutely. I show you again here just real quick on the partner portal, this top bar, when you first log in and create your account, click Enroll Now. we're going to give you a 30% discount. So if you want an individual membership, it's $7.70. You want to cover your whole family, it's a whopping $10.50 per month. You get unlimited access. You get the full program. Download the app for free. Certainly encourage you to do that right over at the partner portal on the HealthiestYou.com website. Okay, here's a question. What if you have an HMO and want to use your copay? Will the doctor call the prescription to your pharmacy, and can you run it through your insurance and use your copay? So you could on the pharmacy side. So let's back up. So you're in an HMO, and let's just call it a $40 copay to see a doctor. Well, you can do that, or you can call HealthiestYou for free. So there's no consultation fee. So that's up to you. If you feel that's something you want to go see that doctor face-to-face on, or an issue that you feel is more appropriate for a face-to-face visit, pay the $40 copay, go in. We encourage you certainly to call HealthiestYou first because it's free. There is no copay for that. There's no cost to you. It's part of that monthly membership fee. So there's no need for that to really communicate back to your HMO because there's no copay involved. And as far as the prescription is concerned, so you go to the doctor, they prescribe you medication. What I would do is pull up the app or go on the member portal, price that medication out, take it to the lowest price that we have on our system, shop it against your health plan, find out which one's better. Maybe your health plan has a better deal on that medication. Maybe our pricing engine can save you a ton of money. We just had a story come in the other day. Somebody went to a Walgreens, they showed their health insurance card, it was $120 for the medication. Jumped on our pricing engine real quick, found it across the street at CVS for $19.99 cash. They got in their car, drove across the street to CVS, paid the $19.99. So you've got options there. We just want to give you options, and you can choose which one you prefer. Is HealthiestYou available to all carriers? If not, how do we know who you sync with? So our carrier syncing functionality with the app has about close to 150 different payers and covers between 90 to 95% of the insured market out there. So if we come across a payer or a provider that is not in our system, the first thing we're going to do is we're going to reach out to that payer, grab the data, upload it into our system. They're very open to doing that. Turnaround time is less than 2 weeks. We'll load that in and make sure there's a provider in there so your group will have access to that. Okay, here's a question around cost. We covered that. Okay, we covered what the alert looks like. Are there doctors available that speak other languages other than English? Great question. So yes, Spanish-speaking care line representatives, Spanish-speaking doctors. The app, where you can download it and hit one button, the entire app converts to Spanish. So we have Spanish and English covered. Member portal, same situation there online. You can actually convert the entire member portal into Spanish as well as the app. Can we get a copy of this PowerPoint? Absolutely. Today this PowerPoint will be loaded up here into our system. Oops, wrong button. Let me see if it's been uploaded yet. I know they're working on it. So what you do is on the partner portal under the employer flyers, you'll see employee presentation. If it's not up there, it may be up there now, but that will be, this PowerPoint presentation will be loaded up there for y'all. And if you want a copy, feel free to email us, support@healthiestYou.com. Or you can certainly just hit the contact button here at HealthiestYou.com. Our phone number, email us here. We're happy to get you any of the content information that you need. Okay. Another question around languages, so Spanish and English right now. Okay, will current member medical history and HealthiestYou utilization automatically download to access through the new app? Good question. On an individual basis, it will eventually, on the new dashboard, this won't be in the first release, it'll be in the 2.0 release, which is probably 90 days after. You will have the ability to see your utilization. We're going to dashboard that for you. So if you, based on your health plan, let's say you're on a high deductible plan, and you call us and you tell us you were going to go to the emergency room, but instead you did a telehealth consultation, we can put right on the dashboard, The average emergency room visit for this issue in your area is $950 as an example. You save that money. So we're going to dashboard your savings in interaction with Healthiest You so we can demonstrate that value. We're also going to do it on the group side. As a UHC rep on All Savers Business, would I have access to the utilization reporting? Absolutely. Can you do individual on a payroll deduction basis? Yes, we do voluntary individual enrollments on groups. In fact, I just pulled a utilization report for this is a group with 930 employees. They did a voluntary rollout of Healthiest You to this particular group. 520 some of them was the last number I saw out of 930 voluntarily option to take Healthiest You as a payroll deduct, 100% paid for by the employee. Utilization on that group is 136% in their first year. So that's why our individual pricing is higher than group. It's adverse selection. But yeah, we can absolutely do a payroll deduction on that. So we just need that census feed from the group or from the software, and we can process this. Can we get this presentation? Absolutely. It will be uploaded on the partner portal, or you can send us an email. We're happy to email it to you right away. Okay. What if my group has stated they haven't got their admin kits? Well, let us know. Again, support@healthiestyou.com. Let us know if for some reason they didn't get that, or somebody grabbed it off their desk and got to it before they could. We'll send another one out and make sure they have that. Okay. Can we get a copy of this PowerPoint again? The app is available to individual plan members. Yes, the app is available to individuals or group members. However they came in, if they bought the membership for themselves, they'll have the app. If they came in through a group, they'll also have the app. Okay. Are collaterals, brochures, and etc. available in Spanish? We do have some Spanish flyers that are available in marketing pieces. If you need those, just let us know. Call us or email us, support@healthiestyou.com. How often are experience reports available for groups 51 plus and 100 plus? So those size groups, we like to do either the 6-month mark or the annual mark for the smaller groups. You know, we have over 3,000 groups here at Healthiest You and growing rapidly. So doing the monthly reports on the smaller groups, you got to be a little concerned about HIPAA issues with smaller groups. So, you know, if somebody knew they used Healthiest You and you got a report back with the top conditions, that may be able to be tied back to a particular employee. So there's some HIPAA things we have to watch. So we prefer the 6-month mark or a year. But hey, if you got something that comes up and you need a report, just let us know. We'll do everything we can to get you that information when you need it. Okay, what happens after a proposal has been accepted? It will notify you in your email inbox. This person had a proposal accepted and it didn't show up in their email box that they were aware of. You might check your junk mailbox as possible, but it will notify you when that's been accepted and time to follow up. Lots of really good positive feedback here on the questions board, so people seem to be really excited about Healthiest You. I appreciate that. Sharing that excitement. This is great feedback. Another question around Spanish. When will the Mom app launch? Apple and Android, they're both launching. For those of you attending the South by Southwest conference in Austin, Texas here in a couple weeks, we'll be there on the 16th and 17th at the Digital Health Summit. A big PR announcement around the launch of the app. So you'll see that hitting the media wires. We'll be at that conference. Keep an eye out for us. Healthiest You have a big booth there, doing lots of interviews with different media outlets with our app. So, you know, at this point, we're a little bit at the mercy of the Apple Store. So things have been submitted, and for those of you that have submitted an app, it can go through in just a few days, and sometimes it can take a couple of weeks. So we're anticipating about a launch in roughly 2 weeks. Assuming no major hang-ups at the Apple Store, which we're not anticipating. Android is typically a little bit easier to get pushed through. But we'll say plus or minus 2 weeks here we should be ready to go. And of course, we'll do a major announcement when that is live on the App Store, so everyone can download and start sharing with your groups. Okay, here's an example or a question around, there are some payers that are including a telemedicine benefit. We see this trend. We're a part of that trend, as we mentioned here with All Savers and other opportunities as well. I will say we have quite a few groups, and some of them very large, that have switched health plans, and the new health plan that has come in has had a telemedicine solution built in. They chose not to get rid of HealthiestYou. And there's a number of reasons why. Again, we're not just a telemedicine provider. There's a lot more that we do around driving engagement and helping that consumer understand their benefits and use it efficiently and accordingly. The app, I think, has demonstrated that. So if you have a competitor that may have a telemedicine solution in there, it's typically a $40 or a $50 call fee to begin with, which I can tell you the payers have extremely low utilization on their telemedicine benefit. So that particular company is not going to see a claim redirection value with a low utilization product. So often we see HealthiestYou going right on top of that plan, as we do with all of our other business, to say, look, we're going to give them free access. We're going to give them this incredible new app technology. It's going to remind them when they're in an emergency room that they have HealthiestYou as an example, and all the other features that go with it, syncing their health plan, making it efficient, making the HR's job a little bit easier. So we're going to put HealthiestYou right on top of that because the value is extensive. And many times, especially in the larger group space or self-funded space, you can easily get to a point where HealthiestYou doesn't cost you anything. In fact, you're actually getting a return on your investment because the claim redirection savings far exceeds the cost of HealthiestYou for that particular year. So good question around that. Do all groups have the co-branded enrollment site? No, you do have to request a co-branded enrollment site, and we typically reserve that to the larger groups. So if you got a group that you want a site set up for and you want a logo put up there, let us know. We'll get that done, but we like to reserve it for the larger group space. Otherwise, it's just simply a HealthiestYou branded site. Do you have specific client webinars just covering the employee portal? Yes, absolutely. So we have a full support team here at HealthiestYou, and many of you have already probably been assigned to an account executive. We call them senseis here, to help you with anything you need. Presentations, we do these all day long, many of them via webinar. So you have a group that you want to just plug into a webinar, and we can come in and do a 15, 20-minute demo on HealthiestYou and show them exactly how it's going to be a tremendous value with that company. Let us do that. We are happy to do those. We have an incredibly high success rate of closing that group when we partner with you all and presenting HealthiestYou on your behalf, answering those questions and showing them how it fits. That's what we love to do. So use us. We're here. You're not going to get a reduction of commission if you call and help us and we help you close it. Everything stays the same. So you might as well use us. We do these presentations all day long, and they are very, very successful. Will the app and the new portal be rolled out at the same time? Yes, the app and the member portal. So the member portal, let me reverse that. The app is basically the member portal in mobile form. It's a complete separate build out, but all the foundation of the functionality of the app comes from the member portal. So those will be rolled out together. Do All Savers Group automatically receive an HY ID card, or do they only have their All Savers ID card to use? So another good question. All Savers Group get a separate HealthiestYou ID card, specifically for HealthiestYou. What's the form used to enroll an association? So you can find the enrollment forms, same form as a group, on the partner portal here under the sales templates. You'll see the actually, I think I hit enrollment forms, excuse me. So you've got the group enrollment agreement, the individual enrollment, if you want to enroll them on paper. You've got those here. Same group would be used for an association. Okay, what contact information regarding reporting and admin kit is given to the brokers when they are all set up with All Savers? What kind of contact information regarding reporting? So on the reporting with All Savers, same thing with a standard group. We work with the broker or consultant that sold that group and the HR admin to make sure they have the appropriate reporting and information. The admin kit certainly gives the phone number to the HealthiestYou admin support contact information. They can reach out to us anytime with any questions. And of course, we do our best to keep the consultants in that loop and keep them aware. How often do commissions pay out? Every month. We pay commissions monthly, and they're usually processed around the 20th of the month, and then they show up the first week of the following month, typically. Okay, do the emails go out with a HY identifier in the subject title? Yes. Should we as agents list our agency's name and address, phone in the email? That's up to you. You will have your contact information in the automated email system here as the first thing that shows up, your name, your email, phone number, all that good stuff. Okay. Can I view this presentation again or at another time? So we are recording this presentation. We'll send a follow-up email to everybody that will attend, that have attended. It will be posted on the HealthiestYou YouTube page this afternoon. You can revisit that or share that with anybody on your team. When will the app be available for current HealthiestYou users? So as soon as our app is approved through the App Store, which we're anticipating about 2 weeks, they will be available to existing HealthiestYou users. If an employer does not want to pay for this, can they offer it to employees for self-pay? Would this then be individual membership cost? Yes, it would be an individual membership cost. They can payroll deduct it, or we can run it through a credit card. Can the premiums be made on an annual basis? Today we only do monthly payments. If you have a very unique opportunity, for some reason they need to have things paid on an annual basis, let us know. We're happy to look at that opportunity and see what we can do to help. Here's a question around small groups. So in this example, Aetna has multiple plans and networks available. Would the individual be getting his individual plan benefits on the app by providing his Aetna member ID? Does Aetna allow it to drill down that deep? Yes. So what you'll see is when you, and this question is around syncing your health plan to the member app. Well, on our drop-down box, you'll see, it's not just one choice for Aetna in this example. Aetna may have 15 different choices. So you're going to match that appropriate choice of networks and then put in your group or individual ID, and it will sync the appropriate network according to your coverage. What if you do not have insurance? So this product can be sold if you do not have insurance. In fact, we've got groups that just, 1099 groups, and maybe restaurants as an example that aren't providing health insurance, but they will pay for HealthiestYou, or they will allow them to buy HealthiestYou on their own. So you do not have to have insurance to have HealthiestYou. HealthiestYou is not an insurance product. It is a membership. There's no underwriting involved, so you're welcome to sell HealthiestYou with insurance or without. Can you call from the UK or Europe or Mexico if you are on a trip? You can call outside the U.S. borders. You won't be able to get a prescription because that needs to be sent to a U.S.-based pharmacy, but you can call in and do a consultation with a doctor if you are out of the country and you're a member. Okay, if an employee is signed up for this through All Savers, can they utilize this service for their family who may be covered under another plan? Could they expand their membership to the family? So we cover the family in that example. So anybody in All Savers has the family coverage. Same thing would apply on a group situation. So maybe that individual employee took an individual health insurance plan, but their spouse has insurance plan through their employer. The HealthiestYou is a family membership program, so they can add that dependent on there at no cost. Here's a question wanting to introduce regional health plans. Yeah, we certainly are open to introductions to regional health plans that you may work closely with and see, find that fit for HealthiestYou. Okay, how is this integrated with VA benefits of active military and veterans? So again, if you're a VA or active in the military and you want to have the HealthiestYou benefit, you can certainly buy that. and you can connect with a doctor at no cost, just part of that monthly membership fee. You can use all the features of that, regardless if you have any coverage or who that coverage is with. Okay, I think we're getting to the end of the questions here. We're pretty close. Are there any marketing materials we can order? Brochures? Yeah, you can download them from the site, and these are being updated here, hot off the press, or you can certainly email us or call us through, find out how to contact us here right on the HealthiestYou.com site. Contact, phone number, emails here. Let us know what you need. We're happy to assist you with your marketing needs. Do I get a website or app of my own to use, something I can personalize? You do have your own website on the partner portal. When you create your account, you see this top right tab here and see my landing page. So you've got your own website here. Now this is designed for an HR director of a company. So the messaging is around group on this piece here so they can learn about it. How does it work? Watch the video. They can request a quote right through your own site. It's going to have your name up here. Then you also have an individual enrollment site. Now this is targeted towards an individual, non-group. So you got a neighbor that you're talking about your HealthiestYou membership, how awesome it is. He goes, I want that. How do I get it? Well, just send them a link to your site. They can enroll now right on here. Pick a plan, right? Individual, they want the family, $15 a month for family. They enroll in here. You get paid the commissions every month on that for all the individual memberships you sell on your website. So it's right, everything's right here in the partner portal. Landing page, enrollment site, you got text messaging tools. Very, very extensive functionality here on the partner portal. So log in, dig in there, search around, take a look. Okay. There's a question about co-branded UHC materials. And I believe that's referring to the All Savers plan, potentially. We do have marketing materials for the All Savers program. If you would like to get those, certainly contact your United Healthcare rep that you work close with, or you can contact us here at HealthiestYou, and we're happy to get those marketing materials in your hands. Is there a limit to how many times a member can call in? No, there's no limit to how many times you can call in. How available is this program in Pennsylvania? Very available. That's one of the active states we're in and providing service in. Here's a question around Idaho, the anticipated launch in Idaho. Good question. Idaho's on a temporary hold in telehealth. I've heard through the grapevine that we feel they're coming back on in the spring, but please, we won't know until that's been official. That's just what we're hearing, but at this point, don't know on Idaho. We're hoping they're back online soon, but we'll certainly keep you abreast of that and keep a close eye on it. Okay. Got some funny questions in here. Lots of humor today. Everyone's in a good mood on this Thursday. Do you have a participation requirement on voluntary plans? Good question. No participation requirement on voluntary. They can, it's the 11 and 15 rate. 2 people can buy it in the company, or they can all buy it. Some good humor here, not appropriate to share on the call, but this is pretty funny. I am a broker. I want an app to use to sell. Enroll me with guaranteed to be my sale enrollment. This is funny. Lots of excitement around the app. Very soon, guys, we're just as excited as you all. We think this is a major game changer in the healthcare space. We call it the claim changer. This is really, really big. So I appreciate everybody's excitement. Stay tuned. It's coming soon. It's in the App Store. Steve Jobs' team is reviewing everything, as well as the Google Play Store. So we'll let you know. It's getting really close. Here's a question around the Windows phones. I know we had started off working on the Windows Phone application too. I got to check on the status of that. We know for sure iOS and Droid and the Google Store will be active. I'll check the status for the Microsoft phones. Do your doctors write the RX script or the major medical plan? So if you call in and do a telehealth consultation, the doctors, our telehealth doctors that we sync you to, write that prescription and send it direct to the pharmacy of your choice. So that will not go through your health plan. which is the whole kind of goal, drive down costs. Can an association admin manage a group? Absolutely. We have quite a few associations that are having tremendous success with HealthiestYou. The admins can manage that group. With our system and the digital pieces we've built in, it's so easy to manage a group through the HealthiestYou platform. We could do a full hour webinar just on our group management system that we built to make it easy for admins to implement HealthiestYou and manage it. Okay, let's see. Okay, if you have an employer group where they have terminated their group coverage and sent all their employees to the exchange, will you still do a group plan for that employer to provide as employees? Yes, we see a trend where groups are buying HealthiestYou for the entire population, whether they're on the health plan or not. And in this example here, you see a lot of groups that are pushing employees to an exchange. Well, you can still buy HealthiestYou to say, kind of ease the blow there. The company can say, look, we're going to provide you HealthiestYou for free. It's covered. We're going to give you this stipend, and you can go to the exchange, and you can buy your plan there. So absolutely, that's a great example of the flexibility of HealthiestYou and the value that can be provided. Okay. Let's see. The AEs that get assigned to a group, can they go out to the group site to conduct a presentation in person, or is it only done via webinar? So we can send AEs out to groups. Obviously there's a travel expense to that. We of course would look at that for larger groups. But if you've got an opportunity, give us a call or call your AE. Let us know that opportunity. We'll do everything we can to support you. So we can do webinar, we can do in person if the opportunity, of course, makes sense. Okay, my sales rep told me there is no broker portal unless we are connected to the sale of the business. I think there might be a little bit of confusion there, but the partner portal, you do not need to have sold any business. Putting the cart before the horse a little bit. You can create your partner portal account whether you've sold any business with us or not, because that's where you're going to get all the marketing tools, the digital marketing pieces, the print materials, your website, everything is in the partner portal. So register there first. Of course, you won't have any groups or commissions or anything showing up in there. That component of the partner portal won't be activated until you have some groups sold. So that may be where the explanation is on that, but you can certainly create your own account. Would self-pay on a payroll deduction process be pre-tax or post-tax? And that, is a question. We certainly aren't tax advisors here, but we would encourage you to check with your tax advisor in that particular group on how they perceive their structure and if HealthiestYou would be pre-tax or post-tax. So apologize, but just not able to give you any advice there. Okay. Are your contracted physicians working for you full-time, or the physicians with their own practice who set aside time for HY? I'd say we have a mix. We have full-time telehealth physicians. We have physicians that work emergency rooms. We have physicians that have pediatrician practices. We have military doctors in the network that are practicing medicine in the military. It's a blend. Some of them may be on an ER shift doing telehealth consultations in between. Some ER doctors, a lot of them work maybe 3 straight 10 or 12-hour days, and then they have a week off. On the time off, they're doing consultations. So there's a big mix of the doctors, but majority of them are still practicing face-to-face care as well as telehealth. Average wait time to be connected to a physician is 9 minutes right now. So an average of 9 minutes, you are on the phone with the physician doing that consultation. Then the consultation duration on average is 13 minutes long. Really good feedback here towards we get to the end of this. Looks like everyone's excited. What days will you be at South by Southwest in Austin? We're going to be there Sunday, Monday, Tuesday, which is the 15th, 16th, 17th of this month. March 15th, 16th, 17th. We're a part of the Digital Health Summit there. We'll have a booth and a team there, so we'd love to have you come by and say hi to us. We're looking forward to that event. Are you creating an app for us to sell individual more easily? That's funny. That's a great question. This is pretty easy though, I gotta say, on your partner portal, my enrollment site. You can pull this up on your mobile phone too, because all of our websites are mobile optimized. You got your own site right here. It's got your name on it. You click the Enroll Now button. That's pretty dang easy. So just pull this up on your mobile phone, type in the billing information, and you're done. That's as easy as we've made it today. This one says, huge opportunity for brokers. Thank you. We agree. And again, I appreciate everyone's excitement. Can I sell other products from this app? Like put a link on it that takes consumers to sell another product I sell? No, you cannot. We want to keep this clean, mean, and lean, the new app called Mom. So I know everyone's getting excited as it's a portal maybe to sell other products, but no, we're going to keep this clean. The focus is claim redirection, efficiency, understanding your benefits. The app for the member is not designed to sell other products. It's designed to steer that consumer down the most efficient path to care and create that stickiness, because they love that simplicity and ease. So we want to keep it that way. Was the webinar recorded? Yes, the webinar is recorded. It will be posted to the Healthiest You YouTube page this afternoon. We also will send a follow-up email where you can click on the link and watch the webinar or share it with some folks on your team. Okay, I think we're getting to the last of the questions. Okay. How do we contact Healthiest You? Let's bring that up to kind of finalize this here. So to contact us, where am I at? There we go. Go to HealthiestYou.com. Click on contact. We have support at HealthiestYou. We've got our phone number. It takes right into our broker support team here. Let us know what we can do to help you. Let us know who we can connect you with. We're here for you. Let us help in any way, shape, or form. So to wrap up and to finalize, how do you get started? Pretty simple. Use the service yourself. So go onto the partner portal. Get registered at HealthiestYou.com. Buy yourself the membership. It's a 30% discount. It's a giveaway. It's an incredible deal. Use it. Embrace it. You can sell it better. Let it save you money on your own health plan and for your family. It's a tremendous benefit, tremendous value. And then use our broker support team to help you close your first deal. We understand you guys aren't experts in this Healthiest You space. If you just got introduced to it, some of you are and have been selling our product and can do it better than any of us here at the office. But for those of you that are new, use your broker support team. That's what we're here for. Don't be shy. Let us help you. All right, so thank you, everybody. I want to wrap up the call and just thank everybody for taking time out. We know how busy you are, so we appreciate you spending time with us here at Healthiest You. Look for the new app here in roughly 2 weeks, plus or minus a few days. We'll keep you posted on that, and really appreciate the opportunity to work with every one of you, and excited to have Healthiest You as part of your group business and individual business. So thank you all. Make it a great day. Have a great rest of your week, and we appreciate every one of you.